Good afternoon. My name is Kaiser Brown. I visited University of Maryland downtown Baltimore location today at the respiratory um, department. My favorite part of the day was the tour. I love the fact that we took a tour of the respiratory departments and certain levels of where the respiratory therapists are normally at. We did look at a couple patients for a brief moment, not too long. We went over a lot of the equipment that the respiratory therapists use on a daily basis, depending on the need of the patient and or more so the patient, because not every patient needs every machine. We looked at one machine that can deal with like a 3-in-1. I would say is a 3-in-1 machine. Um, that was pretty much centered in a room. There are different machines. There are machines for PACU, NICU, adults. There's other names to them. There are a few. There's some old model, new model. I didn't have a least favorite part of the day whatsoever. Actually, I really enjoyed myself. I enjoyed talking to some of my classmates. This is actually the first time in a while that I actually got a chance to actually come outside of my house in a long time. So it was very great to be one on one with everybody and having a conversation. Um, was the experience what I expected? Yes. I worked in a hospital. I have worked in a hospital a few times in my life for about 4 to 5 years. I worked within the healthcare system field. Uh, Probably working, yeah, about 4 to 5 years in total that I worked in the healthcare system. And I have seen pretty much any and everything. It's just that I really enjoyed actually getting to meet some other people because the department that I used to work in, I would see them, but then I don't see them. Sometimes they're more recognized in certain hospitals, and sometimes they're not. So you really don't know who's who. But I really love the fact that this hospital really takes a lot of pride in the respiratory department, and they really actually recognize them and not treat them like they're not there. The day was very helpful because I really went in, just because it's a prereq, and I really wasn't thinking about moving forward with the additional program. But after just listening to everybody today and just seeing everything, I think I would love to move forward in the respiratory program if I can. I would have to do a, like two big life changes events, which is relocate myself just to do the program, and I would have to do a few scholarships just to pay for certain classes and certain programs and stuff like that. But they did help me out a lot to understand that there are scholarships out there for me, and that some things will work out the best for me. They did mention to me that it is a program kind of close to me, but it's still going to be out of my range. Um, So that was very helpful. I was very informed and educated on both sides between what is a respiratory therapist and what they do and everything that they do and everything they can do, and also just information about how to attend the program and stuff like that. Uh, I didn't really know that respiratory therapists could do they can, it's not draw blood, but they can put a line inside you, which is an A line. I did learn that word, A line, like an artery, and that's what they will sometimes. Well, she was saying basically sometimes they can draw blood from that area and stuff like that as well too. Um, so I did learn that part. Really didn't know that respiratory therapists can actually get into the whole phlebotomy part when it comes down to it. She was very insightful that there are just multiple departments within respiratory care that doesn't always require you to be on the floor between the trauma unit and children's or adults. There are other departments within it. It says, "Do I add any other information you feel is necessary?" I don't really have nothing else more to say other than it was just a great thing that I experienced. My 5 minutes are kind of up, but I really enjoyed myself. I will move forward to put an application into further the program. Everybody changed my mind today.